I'm 70 years old. I got terminal cancer. They're trying to help make me feel better. You know, had I got it taken care of earlier, I might have been able to catch it earlier. I don't want nobody else to suffer this way.
I'm Brett Feldman. I'm the Director of Street Medicine for USC and Vice Chair of the International Street Medicine Institute, who provides technical assistance to about 140 programs around the world. And in street medicine, we recognize that people experiencing homelessness just can't access healthcare the way the rest of us do. So we leave our offices and go to the people with the goal of first providing tender love, and then the same quality of healthcare on the street that you would expect in a brick and mortar clinic. Hey, Stephen. Great to see you. Awesome to see you. I first met Stephen when he was admitted to the hospital. He has congestive heart failure. He actually had a pacemaker implanted, lung disease, and more recently was diagnosed with lung cancer. How have you been feeling?
I'm still in pain. I still have a lot of pain.
Today we're going to talk about some of the goals that he wants for himself, for his care, and moving forward how he wants us to care for him.
You may get an appointment and days go by and you don't recognize what day it is, you'll miss your appointment. The health team coming out really helps a whole lot.
Okay, I can order that for you.
Okay. They need more teams like this around because there's a lot of people on the street. They got health issues. I've seen many people pass in the homeless community because their medical issues weren't being properly addressed. They need more teams like this around.
We're here to see my friend Takeisha. For the past 4 years, her typical pattern is that she will go into the hospital in a severe asthma attack. She's been intubated multiple times with the tube down her throat to help her breathe. She'll stay in the hospital for a week or two, be discharged on steroids, and be okay for about a week or two out here, and then back into the hospital. All right, Takeisha, do you need help? How's your breathing doing? You said you're starting to get short of breath again? I'm gonna take a listen.
Yeah, I'm feeling a little dizzy. Before 2 years ago, I was in the hospital, once every 6-7 months. And now, for the last 2 years, it's been like once a month.
So how long does it take you from the time you leave here to the time you get back to go to an appointment?
Good 8 hours, yeah. They've helped me a lot. They've saved me trips to the doctors. They've helped me get to the doctor.
Do you feel like in a few days you'd have to go back to the hospital?
Probably.
You are pretty wheezy.
Yeah.
So I'm going to give you the steroids here to try and prevent you from having to go back to the hospital. Yeah, I wrote it right here. 4 for 3 days, 3 for 3 days, 2 for 3 days, 1 for 3 days, then stop.
Yep.
The Street Medicine Act will help somebody like Takeisha because before we met her, she wasn't able to get any of her medications. But essentially what it does is that it legitimizes street medicine as a real form of healthcare delivery, and in doing so, recognizes the people on the street as human and somebody who's worthy of our care and our love. Louis, how's it going, Louis? I saw you on Friday, and we talked about going then. What's changed today?
More painful.
Okay. Do you mind if I take a look at it?
Yeah.
When I push on the top, in the bigger part, it comes out the bottom. So that means I know that they're communicating with each other. There's a hole. But you see how much packing she's putting in that? It's really deep. A lot just happened here. We came to visit our friend Louis, who we see a few times a week, taking care of a lot of the different abscesses that he gets. And so it was severe and he's going to go to the hospital later today. But the other thing that happened was, just like other, doctor's offices, we get referrals, except our referrals are from one bridge to the next, or what you saw today was one tent to the next. Hello. I'm Brett. Oh yeah, you know me, I guess. So what do you think? You want to go to the hospital? Okay. She had a very, very severe infection of some sort or a burn. She couldn't stand and agreed to go to the hospital. You'll see when you get in. Her leg is, she can't walk and she can't get out. I'm Brett, I'm a PA with street medicine. And I gave them my card so that when they get there, they know that somebody is gonna look out for her. And they'll call us and we'll come see her in the hospital, help them understand what her reality looks like, because the folks in the hospital can't be out here. They can't see where she lives, and that if she's discharged with an open wound, how's she gonna take care of it and keep it clean in this environment? They're not here with us. And after almost 15 years of doing this, I've found that there is a big difference between benefit eligibility and benefit access. So about 85 to 90% of the people we serve not only are eligible, but are signed up for Medi-Cal, or in other states, it's Medicaid. Yet they're not accessing those benefits. So studies show that about only 8% of people experiencing homelessness identify as having a primary doctor. And in LA, about 27% have ever seen that doctor. So street medicine is an essential step of bridging that gap between benefit eligibility and benefit access. So it's a much better use of taxpayer money, because the insurance companies are getting paid by the state, and the doctors who they're assigned to through their managed care, through their insurance company, are getting paid, but the patients are not getting seen. If the intent is to deliver the health care to the patients of which they're entitled to as beneficiaries for their health insurance, then it has to be done under bridges, behind dumpsters, in the riverbeds, and all the care is delivered on site. So we dispense medications, draw labs, we do point of care ultrasound, with the goal of being in their reality where they feel most comfortable, not where we feel most comfortable. One of the things that we get asked a lot is, how do we solve homelessness, especially in LA where the crisis is so huge? And the truth is that all these programs and housing will help homelessness, but it's not going to solve homelessness. It won't be solved by a program. So what we have to do is start welcoming the folks back into our community and take responsibility and stand in solidarity with them. But the people experiencing homelessness, they're our neighbors and we want to take care of them. So start separating the person from their housing status, and hate homelessness, but love the person experiencing homelessness. And until we as a society are willing to stop thinking of them as others and take responsibility as one of us, then the problem won't be solved.